My name is Dr. Shannon O'Keefe. I'm a board-certified clinical nutritionist. I'm trained in functional medicine, and I got into this part of my practice about 5 to 10 years after I started being a chiropractor because I became chronically ill. And I had an extreme amount of stress. My dad had died. I was running 2 practices and running 70 miles south twice a week to run a practice. And so my stress level had elevated to the point where my health started being compromised. And then for my break, I'd go down to Mexico for a couple weeks. And I ended up with a significant amount of bacterial parasite overgrowth in my gut, which made me really chronically ill. I'm going to share another experience I had a year ago that created an autoimmune dysfunction for myself. Some of you that know me know that I had a severe skin outbreak from a toxic chemical that I'd been using. And because my immune system was compromised, we all sitting in this room and everyone pretty much is on a spectrum. You know, I had somebody come in here earlier that said something about a diagnosis. When you finally have a diagnosis of an autoimmune disorder, you're in organ damage or tissue damage at that point. And so autoimmune disease is on a spectrum, and we're going to try to have you understand the magnitude of how the spectrum works and why it's important to try to get to the underlying causative factors of why we get organ damage, why we get tissue damage. And we're going to get a lot into that as we go along. So there's about 50 million Americans that have autoimmune, and I'm going to define autoimmune a little bit different than the CDC does. I'll show you in a few slides how that is. They say 1 in 5. Most of them don't know they have it. And so if you've already been diagnosed with an autoimmune disease, you're in what we call sort of active organ damage. It's going to double in the next 20 years. When I first started my functional medicine practice, my primary autoimmune patient was pretty rare. That was 27 years ago. Now my primary patient is autoimmune, and it's between the ages of 15 and 25. And I'm going to repeat that. An autoimmune disorder is usually, in the past, had been in their 40s and 50s. As our immune systems got weaker, we got exposed to more toxins and such. This disease was an older, like I'm 52, I wouldn't say that's old, but as you're aging, the immune system starts getting more compromised. So most autoimmune things, when I first was out in practice, were 40, 50, 60-year-olds, not teenagers and 20-year-olds. My primary autoimmune patient right now is in their teens and early 20s. And I'm going to tell you why. It's the fastest growing epidemic for healthcare because pretty much all diseases fit into autoimmune disease. We spend $100 billion annually on autoimmune disease. And it's outpacing the numbers for patient expenses for any other disease, even cancer. And I'm going to tell you a secret. Autoimmune disease is the opposite of cancer. Okay, it's the same. Autoimmune disease is hyperimmunity. Cancers are hypoimmunity. So they're the opposite extreme of each other. Okay, so you've got an immune system that's overreacting, or you've got an immune system that's underreacting, and I'll show you in a few slides about how that works. 95% of hypothyroid patients, and we're going to talk a bit about hypothyroid because we live in Minnesota and much of us have hypothyroid, are Hashimoto's. So if you're low hypothyroid and you're on Synthroid or Armour-thyroid, you probably have some autoimmune disorder type situations going on, and you should have your antibodies checked. There are 159 diagnosable autoimmune diseases. These are just a few of the ones. I wasn't going to list them all. You can go on their website. There's an autoimmune.com or something like that, and they list them on there. What is an autoimmune disease? An autoimmune disorder refers to a condition where the immune system starts attacking your own healthy tissues. And so the immune system has gone awry, and it starts looking at your tissue like it's a foreign invader, and it starts attacking it. Okay? These antibodies are supposed to protect us from the outside world. Viruses, bacteria, things like that that come in when you're sick, you're supposed to be attacking those things as they come in. And so what happens over time, and I'll explain how this has gone wrong and why our bodies now are attacking our tissues. These antibodies are supposed to be protecting us, not attacking our tissues. As I said when I first started, autoimmune disease is on a spectrum. You know, everybody talks about the autistic spectrum. Well, this is a spectrum, okay? It takes decades to develop the disease and the diagnosis. If you've got the diagnosis, you've had this for at least 10 years. There is no question about it. It develops slowly over time. I'll show you some slides that'll kind of give you that picture inside your brain. You have to understand the big picture of functional medicine and the underlying causative factors of immune function and how it develops, or you will never arrest the disease process. You will continue to develop on and on. If you have one autoimmune disease, okay, you have Hashimoto's, you have psoriasis, you have MS, whatever, you are more likely to get 2 to 3 autoimmune diseases all in one. So it doesn't stop at one. You know, maybe when you're 20, I have a young guy that had severe psoriasis from head to toe. He walked in here, he was beet red. His skin was elevated. He was so inflamed. He was a college student. And I will assure you that if he had not come in here and started working with me, that by the time he was 30 or 40, he would have developed thyroid issues and other joint issues and so on and so forth. Because it doesn't stop. You know, the immune system, you know, I'm going to make a few political jokes as we go along. The immune system is like the military, you know, and our thyroid and the thing that controls it, which we'll talk about, is deciding, the thyroid kind of decides how this all works. That's why I'm going to talk a lot about thyroid, is because the thyroid gets to tell the immune cells what to do. And so thyroid is sort of the master gland. It's sort of like our president, you know, he's sending troops to the border because there's this threat. Maybe there is and maybe there isn't. But, you know, the immune system has to recognize when it's a real threat and when it's not a threat. And it needs to know when to shut it off and turn it on. And it's getting very confused. And when you have an autoimmune and you're on that spectrum and you've been diagnosed or you have some symptoms, which we're going to talk about, you're on the gamut or the spectrum of that. Okay, so this is the mechanism of the development of the disease. So you start out with cellular damage. So you start, and I'm going to get into the physiology of this a little bit more, but it starts out with cells being damaged, okay, and then it moves into tissue damage. So you might have a muscle cell that starts getting damaged initially, or a joint, your joint cell. We'll talk about RA. And then eventually the cartilage inside the joint gets destroyed. It starts destroying the bone. That's when we get tissue. Then all of a sudden the organ, which is the joint in RA, the organ starts getting degenerated and it develops arthritis. So that's what we call organ damage. When we talk about MS, we're talking about the nerve and the myelin sheath and such. And then you get inflammation, you get organ damage, and it isn't until you get down here to the organ damage that you actually get symptoms. So you go through this entire process before you actually get a symptom and it's diagnosable. So you've gone through this whole stage and phases long before you get a diagnosis. And we want to get you when you're up in this area, up in here, not when you're finally diagnosed with this. And autoimmune disease is very difficult to diagnose. Very, very difficult. Now, this is an autoimmune disease process that takes place with MS. This is a nerve, okay? This is the myelin sheath. If anybody knows anybody that has MS, the immune system is attacking the coating around the nerve. And it takes years to develop symptoms of MS. People have had MS for at least 10 years before they've actually gotten enough diagnosis where they start losing their vision. This might be the optic nerve and you start getting weird vision issues. This might be in your legs. It's hard to know. What happens is the antibodies start attacking this myelin sheath down here, and so the myelin sheath starts getting destroyed by the immune system. And it happens over time, and you don't get symptoms until this sheath here is completely gone, or almost gone. And the sheath on a nerve allows the nerve impulse from jumping from one junction to the next. When you have MS and you don't have any sheath, the nervous impulse runs right down along the nerve, and it causes spasticity. It causes the nerve not to function correctly. And so this takes many, many years to develop. This is psoriasis and skin conditions and autoimmune. And again, the same thing. You have the memory cells that are having a problem down in here, and they start attacking the base of the skin. And any skin condition, psoriasis, eczema, vitiligo, all the skin autoimmune disorders, this is a similar process. It depends on what layer it's attacking. Like with psoriasis, we're down in just the sublayer, where vitiligo is in the area where the pigment cells are. So it depends on where it is in the layer that the immune system starts attacking. Okay? And so in like psoriasis, we have 7.5 million people affected by this, and there is no good answer. I mean, I've seen people, my brother's old girlfriend had psoriasis severe. She went down to Mayo Clinic and they put tar on her and radiated her for like 2 weeks straight. And it's like they're not really when you're treating from the outside, you're not really solving anything. You might be able to get it to go away temporarily, but the immune system inside is attacking here. You got to fix the immune dysfunction. You can't put topical creams on skin conditions and expect them to go away. They'll reduce, the inflammation will reduce, but the immune dysfunction underlying is causing the problem. Okay, so this is old school thinking with autoimmune. We're going to wait until 53 million more people or Americans develop full-blown autoimmune disease. Then they give immune suppression, drugs, immunotherapy, and then you suffer for years. That's the medical treatment. This is the thinking when you go to a medical doctor and you have autoimmune or you've been diagnosed with autoimmune, this is what they do. They might diagnose you early on, your SED rate might be up, they might start doing some testing, but really it isn't until they start giving you prednisone and anti-immune system, immune suppressants that they're actually treating. They're not treating it. They're reducing the symptom. They're not getting to the underlying causative factor of the problem. They're only reducing the inflammation. Okay? As a new school thinking, and why you're all sitting here, is that I want to teach you about the fact that we need to be proactive at understanding why we're producing antibodies towards the tissues that you're having problems with. We want to remove the triggers that are causing the immune system to overreact. We want to repair the damage to the immune system into the tissue, and we want to avoid the years of suffering and the ongoing development of immune dysregulation. This is a statistic from the Autoimmune Association. 53 million Americans are suffering from autoimmune disease, and 10% of the world population. I think it's higher than that, because they've got the categories pretty restricted, and I'll show you. And when you start looking at nervous system stuff like MS, ALS, and all of these kind of things, these are all autoimmune diseases, and it's problematic. Now I found this slide because I want to show you what I think some of the categories are in autoimmune. 1 out of 2 Americans are suffering from some immune disorder. These are all immune disorder things. In your slides, if you can't see them, some of them are, small, but Parkinson's, Alzheimer's, stroke, cancer, coronary heart disease, diabetes, autism, ADHD, ADD, autoimmune disease, and asthma and allergy. Every one of these that I have an arrow to has a direct correlation to immune dysregulation. Okay, now they just have 53 million Americans in an autoimmune, those 159 diagnoses that we talked about earlier. That's this category. In my opinion, asthma and allergies are part of an autoimmune disorder. They're hyperimmunity. This belongs with this. So you add these two together, now we're starting to talk a big portion of our population. Autism, this is a whole nother thing. This is an immune regulation issue. Diabetes, depending on what type it is also an inflammatory disorder. Parkinson's and Alzheimer's are also inflammation on the brain. And inflammation on the brain causes neurodamage. And this is an end diagnosis, but what's the cause of it? The cause of it is toxicity and inflammation, which is an autoimmune disorder. You're describing autoimmune disease when you're describing those things. Okay, so how do people get autoimmune? Now, I have people that come into my office and say, oh, it's genetic, my grandmother had it, or whatever. It is partially genetic. There are certain things, but only 30% is related to genetics. And I know that some of you have heard me speak before, and I know I've told this story before, but I'm going to tell it again because there's new faces in the audience. We are set with a set of genes. Our mom and dad gave us the SNPs. We have the genetics that we have. We pass them on to our kids, so on and so forth. Genetics only manifest the disease if you have a SNP or a genetic flaw. It only manifests if these things are contributing for the DNA damage or to turn the key on. It's like turning the car on. If you don't have the keys, you're not turning the car on. Okay? When you have dietary component, you have toxicity and infection, it turns the genes on that allow the immune system to start attacking its own tissue. So 70% is environmentally induced that causes the genes to get activated to cause the autoimmune disease. Okay, so do you think we have control over this? We do. That's why I'm standing here. I believe that we have control over the fact that we have to get these things investigated. We have to find why you're triggering your immune system to overreact. Okay, now we're going to talk about toxicity. And I heard somebody tell me a couple of lectures ago, I was down at the Nurses Association, they said, you are such a downer. Everything you talk about is like bad news. And I said, but we have a choice. Like, we get to choose. That's the beauty of me standing here. Like, toxicity is a choice today. It's not all of our choices, because even some of the organic, I'm going to talk to you about this in a bit, but we get to choose. We get to buy organic. We get to have clean filtered water if we want. We get to choose how we're treating ourselves. And toxicity is one of the major things that I go after in autoimmune disease. Okay? This was a study that was done in 2005. And there were 143 toxic chemicals that were tested in the umbilical cords of newborn babies. 413. And they had 287 chemical commercials, pesticides, and pollutants in the umbilical cord of infants. 287 chemicals in the umbilical cord of infants. Of 413 they tested. Okay? Of the 287 chemicals detected, 180 are known carcinogens to the human body. In the umbilical cord of an infant, 180 chemicals were found. Okay? 217 were toxic to the brain and nervous system. Here we go. We've got Alzheimer's starting to develop in newborn babies. We're already toxifying the brain because it's passing from mother's placenta over to the kid's brain. Okay? 208 caused birth defects and abnormal development. Okay? 413 were tested out of 75,000 chemicals because they just didn't have the money to do it. So of the 75,000 chemicals that are in our environment every year, they only tested 413 of them. So I have no idea what these numbers would be if they actually tested it all. It would be astronomical. There are more than 80,000 industrial chemicals in our environment today. The EPA is deregulating this. The current administration doesn't believe environment has any value, and so they're allowing companies to just dump their junk into our environment. Only 5% of these 80,000 have been tested for human safety. 5%. Cancer and autoimmune diseases are going off the chart. Okay? Meanwhile, there's 2,500 new chemicals every year coming into our environment that they don't test. Okay? These chemicals are used in more than 6 million products for human use. Lotions, hairsprays, makeup, whatever. I mean, on and on and on. Women tend to have a lot of this because they use a lot of product. Now, I'm going to tell you something. Of this statistic, food coloring was not in this. And food colorings are in every single thing. And they are carcinogen. I'm going to show you in a minute why they cause autoimmune disease. And some of these chemicals resist metabolism or clearance out of the body. They can't be cleared. The body doesn't get rid of them. And so where do they go? They go inside our tissues. The bone, the fat, you know, people that have bone marrow disease and lymphomas and things. The bone is a great storage. It's like a bank vault. It loves to push the toxins into the bone. That's why we're seeing more lymphatic cancers and bone marrow cancers. The body accumulates it in the body tissue. Okay? This is one of the big reasons. Organophosphatase are pesticides that are being put on our food. And you can see that they spray them. It's in our air, it's in the soil, it's in our groundwater, the water bodies. It's in our fish, it's in our water we drink, it's in the meat that we graze. Even if you are eating organic, and I eat organic, if you're eating organic meat and they're out grazing on grass, you've got fallout from pollutants out of the sky. And so even if you do eat organic, you are still getting a high amount of toxins and compared to what it was in the 1950s. Our environment has completely changed. Dairy products, meat, water, and it ends up in our bodies, which causes our immune system to dysregulate. Now, this is the new study. I don't know if anybody heard about this. I hear these things on the news or, you know, whatever, and I go, oh my God. Glycophosphates are basically Roundup. It's in Roundup, okay? And they use this typically in the very beginning of planting to kill off the weeds in between the rows. I was raised in a farming community. And I've been trying to get a couple of the farmers that I know that are patients of mine to stop using this and go organic, but they can't, they're stuck. So now what they're doing with this, because the growing season has shortened and they don't get enough drying time, it's very expensive to dry corn and wheat and grain and such or whatever, they're using Roundup to spray on the harvest 2 weeks before it's harvested. Okay? So Roundup gets sprayed up and guess what it does? It dries it up and it takes all the moisture out. So they spray it on the wheat and the legumes and the rice, not rice because that's gone in patties, but a lot of the grains are being sprayed with this so that they can reduce drying time and they can bring it in and they can extend harvest length to increase crop. These cause damage to the gut. I'm going to show you pictures of this. So when you're not eating organic and you're getting grains that are sprayed with Roundup right before you eat them, these don't go away. These stay in the grains. And people say to me all the time, why is everybody gluten sensitive now? Because they got sprayed on the gluten. The gluten's been genetically modified. It's not the same product as it was when in the 1950s with the heirloom grains. And so many of these products are causing our systems to malfunction. Anaphylaxins, this is another toxin that's in mold. It's a mold. It's aspergillus, which is a mold that's found in rice and peanuts, and they cannot get rid of this. right? They've tried every kind of thing under the face of the earth. The peanut growers went nuts for about 10 years trying to figure out how to do it. Now they don't do anything. They just sell it with the mold on it. The market rejected peanuts for a long time. And now they said, well, there's nothing we can do about it. So even when you're eating organic peanut butter and you're feeding it to your kids, they're getting aflatoxin, which is a mold. It's a known carcinogen. Okay, formaldehydes, these kind of things are found in like particle boards, fabric retardants, they're carcinogens, disinfectants, water treatment, preservatives. These are carcinogens that are in our environment on a regular basis. Everybody knows this one. This is in plastic, bisphenol A, phenol A, however you pronounce that. It's in plastics and paper products. The European, United States, Union, Canada have banned EPA from baby bottles. Well, do you think it's any better for adults? This compound is almost identical to the thyroid hormone. When you look at the chemical structure and what it produces, this chemical is almost exactly like the thyroid. So when you get this in your system, and the immune system goes, hey, what is that? It starts looking at it and goes, I'm going to attack that. Well, what if it's a cloudy day in your immune system and they have their shades on and they don't really know, is that the thyroid or is that this plastic chemical? See, that's how we start attacking tissues. Because many of these chemicals that are in our food and water look very similar to our tissues. That's how autoimmune diseases get started. This is the lacquer coating inside food cans. Xenoestrogens are in the plastic of these cans. They have this stuff in, it leaches in, and it is a known carcinogen. This is partly why we have so much breast cancer and estrogen-based, prostate cancer and such. Heavy metals, this is a topic in its own. It dysregulates immune function. They attach onto the receptor site where immune function handles, and it is found in everything. We live in the metro, or most of us live in the metro area. We get most of our water from the Mississippi River. Many of, I think 3M just settled a lawsuit with the state of Minnesota. And I'm going to tell you that I've had my water tested here, and we have very high arsenic levels in our water in the metro area. And it is found in a lot of different things. So heavy metals are definitely part of our picture as why autoimmune disease is so high. Now we're going to talk about the dietary component in the foods and how this immune system thing gets regulated. So we've talked a little bit about the toxins, we've talked about a little bit the foods. Drugs and toxins, in my opinion, are the same thing. When you take a pharmaceutical drug, it is a toxin to your system. When it is not bioidentical to what your body makes, it is an exterior chemical that your body has to detox, the immune system has to recognize it and decide whether it's safe or not. We have pathogens. I'm going to talk just a tiny bit about that today. That's another kind of topic, but these things cause GI inflammation. This is the lining of your gut right here. These are the cells that take from the hole from your mouth to your anus. There's a tube, and this tube is lined by these cells, and these cells decide what stays in the gut and what goes into the blood supply. Okay, this is the border wall on the Mexican-U.S. border. It's going to decide who comes in and who doesn't. Okay, and so here we have the, these are what we call zonulin, and when you get a lot of this stuff going in, that breaks the bind and allows the immigrants and these people just to flood into the United States. So here we have all of these things, the bad guys, the drugs, and they start coming in, which causes the immune system to start getting really upset. Okay? Now, the mechanism, I'm going to mainly talk about oral tolerance. We're going to talk about oral tolerance because our immune systems have to recognize between the good stuff and the bad stuff, and that's called oral tolerance. We're going to talk just a bit about the central tolerance. That's a whole topic in itself. Oral tolerance is when you take food And when you are born, your GI tract has nothing in it. From your mouth all the way down your anus. You have no bacteria, you have nothing, it doesn't do anything. And the reason that it's that way is you've got to be able to absorb the sugar and the fat in your system very readily because you're growing. You started out at 6.5 pounds and you grow and you pack on weight very readily because your GI tract has no sort of built up defenses against it. And so what happens is the mom is supposed to do that for you. Okay, so you eat food, the mom eats food, and then it goes through this whole maternal digestive process to determine whether it's safe for baby or not. Unfortunately, many of these chemicals and things are getting into the breast milk, and it's going in and causing problems for baby eventually. So the oral tolerance is the active inhibition of the immune response, meaning you eat an apple, you eat a piece of chicken, the immune system recognizes that as something good and it says, okay, we're not going to do anything about that. So this is what we call oral tolerance, and this is what we call reactivity versus non-reactivity to food issues. Okay, how does oral tolerance fail? Because of diet, chemicals, food, artificial sweeteners, pesticides, etc. We'll go through that more. So everybody knows what this is. This is Mr. Peanut. And Mr. Peanut has a bunch of amino acids. It's got 63% protein, 22% fat, 10% fiber, and 5% other. Okay? Now, here's what else it has on it. Anafloxacin, remember I talked to you about the mold a couple slides ago? Pesticides, herbicides, and heavy metals are on this. And so what causes and how does this get into our system and then determine how this is going to work? So this is how it works. You eat this, you chew it up, you swallow it, and then you start producing digestive enzymes. And digestive enzymes start breaking down. We have hydrochloric acid in the stomach, and these digestive enzymes start breaking these amino acid chains, that's mainly protein, down into small particles so that we can absorb it into our blood supply. The immune system looks at this and goes, is this safe or not? Is this safe or not? Safe or not? It looks okay. I think this will be okay. So it'll say, okay, we're not going to induce an immune reaction towards this peanut. I'm going to talk about a peanut thing in a minute, why all kids are allergic to peanuts now. And so this thing creates an immune regulation. The immune system, 80% of our immune function is found in the gastrointestinal tract. 80% of our immune system is in the gut. Okay? Most of what we take in is through oral. We drink water, we eat food, we breathe air, which is also, there's a lot of immune system in the lung. But most of what we take in from our environment is through oral. And so it's a very strong response. This decides whether or not it's going to attack this thing or not. Okay? Now here's the same peanut that we have that has all this stuff on it. It has the pesticides, the heavy metals, the digestive enzymes, and the afloxacin. You can see it goes through the same process, and the digestive system is having a hard time breaking it down because there's all this extra stuff on it. Okay? And then the immune system looks at this and goes, what is this? And it starts mounting an immune response to this. Okay? So now you're anaphylactic, or you're creating a secretory IgE, which is an anaphylactic shock, or an IgG, which is a food allergy reaction. Okay? So now this peanut has become the enemy. Okay? Now you're sitting there thinking, well, how does that have to do with autoimmune disease? Okay, that's a food allergy. I'm going to show you in just a second. So this process is really one that starts the whole autoimmune dysfunction out because the immune system is detecting danger. Now, I'm going to tell you for a period of about 15 years, they used peanut protein in vaccines. They used peanut protein in vaccines. So you have to take the virus or the bacteria that you're vaccinating your child with, it has to be attached to a protein to get it into the system. Okay? And so what the pharmaceutical companies were using peanut protein to use in childhood vaccines. And so peanuts become the anaphylactic. You can't even eat a peanut on an airplane anymore. anymore because it'll cause anaphylactic. And why? That's exactly what the immune system is supposed to do, right? You inject something into your arm with a bacteria or a virus or something in it, and it has a peanut in it. The minute you eat peanut, it's going to send your immune system right off into Never Never Land. Okay? They use egg whites. They use lots of different proteins now.